Welcome to Chapter 3. We will discuss in this lesson principles and ancillary functions of the healthcare record. In today's learning objective, you will be able to identify and explain the possible functions of a health record. You will be able to define the terms information and data and distinguish between them. You will be able to identify the ancillary functions of the health record, explain the special roles of a health record. You will be able to discuss the right to access, release and disclosure, and retention and destruction of a health record. And you will be able to list and explain the most common secondary indexes, registries, and databases that's maintained by hospitals. So let's get started. The term data and information are often used interchangeably, but the two terms have distinctively different meaning when they are used in reference to health records. Data represent objectives, descriptions of processes, procedures, people, and other observable things and activities. Data is collected in the form of dates, numbers, symbols, images, illustrations, text, lists, charts, and equations. Where information is the analysis of data for a specific purpose which results in information. Data represent facts and information conveys meaning. In other words, data themselves have no meanings until they are considered in the context of specific purpose or function. For example, a chart showing a series of columns and time stamps, initials, numbers, and symbols would have little meaning outside the context of the patient. So just because I see 97 degrees temperature, it has very little meaning without identifying who is the patient with the 95-degree temperature. So the number and symbols, if we had the patient in context of the number and symbol, the observation of the vitals of that specific patient would make more sense. And the times, the date, the initials, and would constitute authentication of the health record documentation of those observations. So regardless of the storage format and function of the health record, it remains the same. The health record serves as the principal repository for clinical documentation that's relevant to the care and treatment of a specific patient. The principal functions are related to specific healthcare encounters between that provider and that patient. The ancillary functions are related to environments in which healthcare services are provided. So let's talk about those healthcare services. The principal function of a health records are administrative, information, and demographic data. So these are actually for elective hospital administration. The patient or the admitting physician, office staff often provide administrative information in demographic data before the patient comes to the hospital. So they often collect this information from the patient once they arrive or before they arrive to actual healthcare environment. Admitting and registration information, the patient access or registration staff, so there's patient access or registration staff. They tend to come in and collect these details about the patient and information about the patient's health insurance coverage at the time they are admitted to the hospital. Patient care delivery. So the EHR combines information about the patient illness and documentation of the services provided. So clinical observation of the patient, results of the physical exam and diagnostic tests, details of the medical surgical procedures and descriptions about any type of therapeutic outcomes. They're all documented in the EHR. And then we have patient care management and support. Now, this encompasses the activities that's related to management and services provided directly to the patient. So many of these activities require an analysis of health records to determine an organization financial health and the relevance of its services or the development of clinical guidelines for the patient. Quality management and performance improvement. The accreditation organization and licensing body, they expect hospitals and other healthcare organizations to strive for the highest possible quality and customer care. Now, these organizations have written standards that healthcare organizations must meet to be accredited. Quality management is the evaluation of the quality of healthcare services and delivery using standards and guidelines developed by various entities, and including the government and independent accreditation organization. Performance improvement is the continuous study and adaptation of the healthcare organization's function and processes to increase the likeliness of achieving desired outcome. This continuous quality improvement, which is CQI, is a component of the total quality management, which they call TQM, that emphasizes ongoing performance assessment and improvement planning. Now, in 2017, Joint Commission replaced the National Hospital Quality for hospitals with 2017 ORIC performance measures. The Joint Commission uses the quality checks and quality reports to differentiate healthcare organizations that achieve safety and quality goals. So the purpose of the quality check is to list Joint Commission's accredited status. Organizations that's listed on the quality checks that are not accredited by the Joint Commissions are for comparison purposes only. Now, quality reports provide an overview of how well an organization or an accredited organization or certified program comply with Joint Commission's requirement. Quality reports can include some of the following. So they can include accreditation and certification decisions and the effective date of decisions. It will include the National Patient Safety Goal compliance, when applicable, the National Quality Improvement Goals performance, which is for hospitals only, on key quality or quarterly quality of care indicators. Also, the top performers on key quality measures and special quality awards. The Joint Commission is not the only organization with quality management and performance improvement initiatives. The Medicare program first established a system of quality reviews in 1982. Now today, local quality improvement organization, which they call QIOs, work under contract with the Center for Medicare and Medicaid Services. Now, this is a federal agency that administers the Medicare and Medicaid program. The QIO contracts set target related to CMS federal targets at the state level based on a focal set of publicly reported quality measures. Now, the mission of this program is to provide an effectiveness, efficiency, economy, and quality of service delivered to Medicare beneficiaries. So healthcare organizations submit patient information collected from the health records to the QIOs, which then review the appropriateness of delivery of care. In 2014, work began on the QIO program, the 11th statement of work, which extended through July 31st, 2019. The 11th statement of work has 6 CMS quality strategies that may be found in Figure 3.2 of your book. So please take a look at the 11th statement of work and read that particular content that highlights all of the goals. Now this ends this part of our lecture.